Welcome to this Autism Ontario webinar, Why and Where Culture Matters, in working with diverse children and youth with autism and their families. My name is Matthew Lay, and as always, I will be your host. 40% of the approximate 250,000 people who immigrate to Canada each year land in Ontario. Toronto is widely regarded as the world's most multicultural city. And there are over 100 languages and dialects spoken within Toronto and the province of Ontario. And with that comes a lot of cultural diversity. And for that reason, we are here and we are speaking to Dr. Mohammad Zubairi. He's a developmental pediatrician at the Ron Joyce Children's Center and assistant professor at McMaster University. Mohammad, it's your first time here. Welcome. Thank you for being here. Before we get started, we have a few housekeeping items. First off, why do we do these webinars? So the primary reason that we run these webinars is to educate and inform all of you. Those are parents, caregivers, practitioners, and we're also doing this so we ensure that within the autism community, we are talking about the topics that matter, like this one today. You may or may not know that we do this through money that we receive from the provincial government. And we have a mandate to reach as many Ontario citizens as possible. So when this webinar ends, if you've been here before, you know my sign-off. Share this with your friends, family, and loved ones. And the reason I say that is that the more people who see this, the more educated the community becomes on these topics, and the more of these webinars that we are able to do. So click that share button or just email this link to anyone that you think might be interested. That's after we get through the show, though, Mohammed. We got a lot to do before then. First off, remember, submit your questions at any time using the Ask a Question widget. It will show up here on my iPad. I will aspire to get you answers. There are a series of resources that help inform our conversation today. Click on that as we speak to them, download them. An example being that we have a link there to the Access Counts 2019 Autism Conference, which, if you're interested in this topic, you will be interested in that conference. If you have any issues, questions, comments, concerns, click the help button and someone from the team will help you out. So with all that underway, let's get to why we are here today. Mohammed, I think I might have stole the thunder, but I'll still ask the question. You know, we are a diverse community in Ontario, but why are we talking about this topic today? Why does it matter?
I think, you know, you're right that we're really fortunate to be living in a time and in a moment where we're having lots of opportunity to engage with families that are really coming with lots of different stories, histories, backgrounds, experiences, and it sets up for a really nice opportunity for us to take a step back and reflect upon what this means for providing care, for working with those families. We know from the literature that newcomer families and those that are low income can often have a lot of barriers when it comes to accessing services and resources. So I think it really sets up an opportunity for us to collectively as a group, as frontline providers, but also as families of individuals on the spectrum, to take a step back and think about these issues and learn from that collective experience that we've got.
Right, and everything that's going on in the world today, globalization is a huge factor. How does it play into this topic?
I mean, I think it's really made our world a much smaller place. And what's fascinating about that is that there's lots of movement that's happening. When we think about movement of people, we think about movement of ideas, we think about movement of practices. People are training in one part of the world and working in another.
See that a lot within your community, right, with physicians?
Absolutely, and I think it sort of creates a moment for us to sort of say, how is all this movement influencing what we do in our day-to-day practice? Because I think ultimately for me, one of the challenges is that there's lots of work that's being done, but how do we distill it down in a way that is meaningful and practical for the families that and the children, youth, and the families that we see on a day-to-day basis?
Right. So how we're going to talk about today, and that is this research that you've done? What is your approach to this?
I think for me, it stems from research.
Okay.
I've, as an academic, I've thought long and hard about these issues when it comes to thinking about them from a theoretical perspective and asking the right set of research questions. But I think what I'm particularly interested in is how do we take that research that we're doing and asking those broad research questions and distill them down to everyday practice, particularly as we translate that knowledge. I'm particularly passionate about reflective practice in particular.
What do you mean when you say reflective practice?
Reflective practice is really a form of orienting yourself to what you do day to day,
right,
and thinking deeply about it. To say, you've committed to a particular action in a clinical encounter, or for example, you're thinking about a clinical encounter after the fact. What can you learn from that encounter? For me, as a primary clinician and diagnostician, there's moments every day to take a step back and say, how could I have done this differently? How could I have learned from this? How could I improve this the next time that I have this same moment? So it really is that lens of reflective practice that says, okay, how do we bring that down to our daily interactions? And it creates lots of learning opportunities. Sometimes we have the spaces to do that,
right,
and sometimes we don't. And so, one of my goals in thinking about this topic is really to say, as individuals, as practitioners, as organizations, how can we create those spaces to be able to support that and really fine-tune our practice as providers of and having the opportunity to work with individuals on the spectrum.
How do you come at, what's your story? I mean, we saw your accolades, but what's your story? How do you come at this problem?
I think for me, I've always been attuned to it, partly because, I've had the opportunity to live in multiple parts of the world. I come from a family from Pakistan, grew up in Saudi Arabia, moved here to Canada in 2000, and it really, I think, gave me a lens to sort of see how things happen differently in different parts of the world and different experiences. And I always became fascinated when I started my work in developmental and behavioral pediatrics to sort of take a step back and say, we're giving all this information to families. What are families doing with that information? And I was particularly humbled by a couple of different instances, but really I would sort of take a step back and say, we have a way in which we come to a diagnosis, and that way has changed over time. I think, when you sort of look at the literature, what we've defined as autism has evolved. But the ways in which I was trained and many people are trained is that, these are the set criteria, this is the set sort of guidelines that you come to make a diagnosis. And so, but what I was intrigued by is that, once that information was given to families, did those families' varied experiences, backgrounds, and histories influence the uptake of that information? And what they did with that information to be able to then say, okay, in a 45-minute feedback appointment, there's a lot of information that's exchanged, but then what happens after the fact? And that's sort of where I became particularly interested to say, what's the alignment between what we do as clinical practitioners, what we're expected to do as clinical practitioners, and how are families perceiving that information? Because I think that's the piece that we often don't have immediate feedback on. And there's implications for how those families then go ahead and navigate the system, which is a complicated system, right? And so I think it really does lend itself to sort of asking those questions and taking a step back and saying, okay, what does this mean in terms of my practice, in terms of the practice of other professionals, and how that uptake is taking place?
So it's difficult to navigate for anyone, and these people on this webinar know that all too well, every topic that comes up. But I want to touch on something that you said early in that answer, and that was you were humbled. So clearly someone with your background coming to the country in 2000, seeing the difference in cultures and whatnot, it would be easier for you. But can you tell me one of the stories about when you were humbled that pushed you here?
I think, it was during my training as a developmental pediatrician, and I had a set of parents from South Asia, and we were in a scenario where the teenager who was on the spectrum was living in a group home setting. And the father sort of, looking at me, also visibly South Asian as a practitioner, was struggling with expectations from his family and his broader community to bring the child back home from a group home setting. And there's obviously a a whole layer of complexity that exists there. But the father sort of looked at me specifically and said, you know, having shared those experiences and those pressures, say, hey, doctor, you know what I mean, right? Or you get what I mean. And that really sort of, as a relatively junior trainee, sort of struck a chord in being able to take a step back and say, well, that's the experience of one particular family in a very particular context, given all the other, you know, sort of experiences that they may have had, and that they're making this statement now. And so I sort of took a step back at that moment and started to actively reflect on it in more deeper ways that has in part informed, you know, my interest in my sort of awareness of these particular issues.
Well, I mean, hearing that story, so many things go through my mind. Like, number one, I never consider the heritage of my doctor. I haven't had a, you know, Anglo-Saxon doctor in probably over a decade, and I never consider it. I'm getting medical advice from a doctor. It never comes out. But on the flip side, if I was the guy in the lab coat that day, I'm sure that would have been stated in a different way. You don't understand why he should be coming home, or whatever it might be. So, I mean, that is very powerful, and leads very nicely into this, the complex web that, you know, when I looked at this slide, I found it very interesting because I've had the opportunity to be on the desk with people in the academic, like the educational sector, ABA, speech pathologists, and all of that. And then there's always a footnote on the things we look at, and then it's always like, and clearly culture has something to do with it. Like, look at that. So it's a footnote. But you put this together. What do you see when you look at this?
I think for me, what this particular slide emphasizes is that as individuals, we're caught in a series of worlds that we exist in. And sometimes it's easier for us as practitioners to think about how these webs might, or these different worlds might compartmentalize into individual silos. But the reality is that all of these different identities that we assume, or worlds that we belong to, social worlds specifically, intersect. And I think part of the challenge for us is that, you know, a lot of our training models and the ways in which we engage with families is to think in isolation of each of these areas, right? So you might think about cultural identity, you might think about professional identity, you might think about, you know, sort of the context in which the families exist, but it's really about thinking about how all of these things intersect with one another. The metaphor that I often use is that in our training models, we're often sort of, you know, if you imagine sort of making a cake, and there's a recipe with certain ingredients, you know, people will often focus on, you know, coming to a diagnosis as the main foundation of building that cake, and that issues of culture and socioeconomic status and identity end up being the icing on top. And I think part of our challenge now as a community is to say, actually, you know, how we perceive disability or how we perceive difference in terms of ability is actually influenced by all of these elements that exist, right? And for us to think about them in silo, you know, is something that potentially parents perceive, but it also potentially influences how those parents then move with that information moving forward in terms of their values around disability or illness, their family supports that are in place. And so to be aware of those requires us to take a step back at that slide and say, really, when you're meeting a family in front of you, you should be thinking about all of these things, rather than saying, okay, well, you know what, I'm going to think about that later. And that also then has implications for our training, because we're often trained to think about diagnoses using gold standard equipment, gold standard tools, but that may potentially be influencing that interaction in a way that is going to be less meaningful, less practical for that family that we're engaging with.
We'll go back to our analysis. If I was the one in your humbling experience, that feeling that that father may feel that I don't understand where he's coming from because of my non-East Asian background, could mean that all of that great information on the diagnosis gets forgotten or is not important because he doesn't believe that I understand him. I got some questions from the audience, and it's great. I love when you guys do this. We're about to get into the how, and you're asking how, so we'll take some of your questions before we go back to the deck. Do you have suggestions or resources around a reflective practice exercise that practitioners can engage in as we work with families? I'd like to have my frontline therapists think about this more.
So I actually was fortunate enough to to do an exercise where we drew upon the literature on simulation specifically. And one of the things that we did is that oftentimes simulation or simulated activities where you're working with standardized patients or actors often are created by one group, and then you kind of have to participate in them kind of downstream. So one of the activities that we did is we really created a space for a group of interprofessionals to come together with various backgrounds, including speech-language therapy, nursing, and gave them the space and opportunity to actually reflect on the types of issues that were coming up within their day-to-day practice to inform the development of a simulation.
Okay.
So what you're actually doing is that you're thinking about your practice, you're identifying the issues within your practice, and you're learning from one another along the process, and then using that as a way for continuing education.
Okay.
And what was fascinating about that work, and this is what I'd encourage all of us to think about, is that we actually engaged with a patient facilitator.
Okay.
So somebody who had had a lived experience of the particular condition that they were thinking about. It wasn't in the autism context specifically, but it really then provided real-time feedback to say, you know, this is sort of what I felt within that particular moment, and this is how things can be tweaked. So it really sets up, and part of that work was also reflective journaling that the practitioners could review, but it was a nice educational activity to say, we're going to build something that our organization or institution can use for engaging in such an encounter in the future.
With every, you know, in our diverse multicultural society, with every, you know, regional location having a different subsection of these challenges, I can see why that model works. Is that a available model in not in market, but is that based around a model that's used elsewhere? Did you guys make it up on the spot? Do you know?
Yeah, so we've actually, there's been a lot of work that's looked at developing cases, right, that are driven from practice interactions. But that was a model that was actually, that we helped develop. I was part of a group when I was at Holland Bloorview, helped create that. And it really there is some literature on that I'm happy to share afterwards. That gives the practical steps involving, most importantly, storytelling. And that's what was fascinating, is that frontline practitioners have so much narrative that sometimes the spaces aren't there to be able to share that narrative and share those challenges or successes in a setting where everybody can learn from. So it's referred to as building a simulation. Whereas, again, eventually you get to participate in a simulation. But yeah, I'd be happy to share that particular resource.
Great. So what we'll do is we'll get that added after the fact to the Resource Center, which will mean that you have to come back to grab it. And when you will get an email to watch this on-demand link, pass it on to your friends, family, and loved ones. And we're also going to be publishing Mohammed's email address at the end of the session, or if it's not already up there for you, so you can reach out directly if you want to have any further dialogue on that subject. This is a massively broad question, which I think we can probably answer with where we go next here, but that is, what is the best way to communicate with families as it relates to those families coming from various diverse backgrounds?
Well, that's what this is about, right? I mean, ultimately, I think there's two issues. One is that, generally speaking, we've often thought about tools for working with individuals from diverse backgrounds falling under the domain of communication, right? In terms of simple initial steps, which is having access to interpreters or those that can help with sort of language translation. I think the challenge is that, you know, sometimes through that process we limit the stories that we allow families to tell us. And what I mean by that is that, you know, often as practitioners we may have certain goals that we have to get through, and as we've shifted towards more of a patient-centered model, I think we've become more aware of asking families what their goals are. But not every family is going to be prepared to answer that question. So I think the challenge is that how do you facilitate asking individuals and being direct with families about what is it that you're hoping to expect within an interaction after explaining your role and who you are, and really being able to reflect upon and giving them the space to then give their perspective. Whereas, and being open to that perspective, I think becomes very important. And those are issues that have sort of cross-cultural approach or reach, right? But ultimately, I think being grounded in explaining your role having the opportunity to families to tell their story in a way that reflects what their understanding of that visit is, and using that as a starting point for establishing some common ground so that then you can move forward in whatever comes next, whether that's diagnosis or therapy or other forms of intervention.
Right.
So I think communication is one piece, but I think the other pieces that I was mentioning earlier on is being aware that beyond communication, there is a whole set of values, belief systems that may be playing a role in our day-to-day interactions.
Right.
And so just being aware of that and being able to explore those in a sensitive manner, I think part of it is being able to ask the question. And sometimes I think there's a hesitation to ask the question with fear of offending, but being able to say, how do you view disability or illness in your community? There's a lot of rich information that can come out of that. And so I think that's a starting point for that type of a conversation.
Right. And we have also published specifically on communication one of your articles, Cross-Cultural Communication, Tools for Working with Families and Children. You can get that in the Resource Center. This slide basically talks about where we're going next is what we're doing here is, you know, a cultural encounter versus all encounters being cultural. How does one look at it this way?
So I think this goes back to that metaphor that I was sharing earlier and the afterthought or the footnote discussion that we briefly had, is that I think, you know, if we take a step back and really try to identify that every person that you're meeting within the context of your clinical practice, or other practice for that matter, comes with a set of stories. And those stories can be mediated by or influenced by that individual's cultural background, ethnocultural background for that matter, really shifts the focus on thinking more holistically about that particular encounter, rather than, you know, saying that, you know, okay, now we've gone through our process, we've made our diagnosis, we've come up with our recommendations, and this is how we'll modify them from a cultural perspective. I think there's a space for that latter piece that I've just mentioned, but ultimately where the challenge comes is recognizing that from the moment that you're preparing for an encounter to the moment where that encounter ends, there is culture at play, whether or not that's the culture of the individual that you're seeing, your own professional culture, your own ethnoculture in terms of that interaction. All of those things are happening. And I think being reflective and aware of that then facilitates a form of communication that can be quite healthy and positive for the families that you're seeing.
And there are both visible and invisible elements of culture. There are things that just can't come out unless, I guess, you talk to them. It's something you got to keep in mind, right?
I think so, and I think what one of the pitfalls or challenges that we can run into is that sometimes it's easier to identify, or not sometimes, many times it's easier to identify those visible elements of culture that you might recognize, right? Something as simple as accent, that might suggest that there is another story there. But that doesn't necessarily reflect all, like a common cultural experience for that particular group. So you want to stay away from being able to stereotype, right? Because that can, again, create certain risks for your assumptions within that clinical encounter. And so I think part of it is just being aware that there are invisible elements that can be at play, and often are at play in terms of an individual's understanding of reception to what it is that you're trying to communicate with them.
Those who would argue, and I'm not arguing for it, but those who would argue, you know, the benefits of profiling or racial profiling in the law enforcement industry in the United States, they say that it's done because there's a lack of understanding generally about certain communities and cultures. So I understand what you're saying, but that's not an easy thing to do. How do you start to look at these invisible elements? How do you become? You can't become a culture expert while you're becoming a medical expert, can you? Is that what it's about?
I think, and I'm glad you brought up this particular slide, because I think this is really one of the challenges for us moving forward, is that in our attempt with very well intentions to be able to address these issues, we've constructed and created lots of approaches, right, including the ones listed on this particular side, and each of them comes with its own sort of criteria, and I think the challenge is that as individuals and as organizations, how do we operationalize these within our context? And so when we talk about cultural humility or cultural sensitivity, it's speaking to an understanding that, yes, we won't know everything about a particular individual that's in front of us. We should be aware of it, right, in terms of our recognition. But then, it gets deeper in when we think about competency and safety, is that, when we are engaging in an encounter, there's power dynamics at play, right? In terms of our day-to-day interactions, and that can set up certain scenarios that make it very difficult for us to really tap into what that family is bringing forth to us. So having the space to be able to think deeply about these issues in a way that is more than just a checkbox, right? I think that's the challenge that lies ahead, is that we can say we're a culturally competent organization or a culturally competent group, but what does that mean in practice? And being able to get feedback from frontline providers and families, because I think they're the ultimate recipients of what we do in practice, and how institutional policies and organizational directives stem down to day-to-day practice, and whether there's an alignment in that when we think about what families are perceiving. I think that's the challenge, right? I think the challenge is to how do we take these concepts and operationalize them in a consistent manner.
So we have at least one person who is referring to the frontline staff, so at least one person in, call it a managerial or a leadership position. Because you are the expert sitting on the desk, you may not have the answer, but of what we see here and everything else, what do you think is the best approach to this if you have responsibility over an institution, a clinic, or whatever it might be?
I think it's, and one of the things that I've thought really hard about is that when we think about a patient-centered care and family-centered care, I think, and as we articulate quality of the care that we provide, just as that we want to ensure patient safety and across domains and client safety across a variety of domains, I think cultural safety in and of itself also becomes a domain that is worthwhile exploring, because that's the one that really highlights the potential power imbalances that can exist in a day-to-day clinical encounter. And so how do we maximize our ability to mitigate that?
So cultural safety is making those of a different culture feel safe? Or I'm sorry,
No, I think that's an excellent question. I think it actually comes from work that was done in New Zealand with Maori cultures, specifically indigenous populations within that context, where there was a full recognition that there is a power imbalance that exists in that clinical encounter, and that can affect the dynamic between the community that's being treated as well as the practitioners. So I think it's continuing to recognize that people who are presenting to your practices as clients and as patients may be coming from experiences where they do feel that given their context, they may not be able to share everything, or they may be judged, or they may be stereotyped, right? So there's all that risk there. So how do you kind of take a step back and say, well, what are we doing as an organization? And some organizations actually very nicely have developed equity, diversity, and inclusion lenses. So that everything that happens at a practice level, at a research level, at a clinical level, at an administrative level is looked at through that lens. And I think it raises some of the questions here in terms of these particular constructs that have been developed in the literature and how they distill down to frontline practice.
And go back to some of your questions before we move on and deal with some gaps in the system. I don't think my service provider is considering my family's cultural background. How can I encourage them to think about some of my child's experiences as it relates to our family?
I think that's an excellent question, and I think part of it is, and again, keeping in mind the conversation that we just had, is that sometimes being able to share that can be an intimidating process in and of itself. So I think, from the part of the provider, first there has to be a level of openness, a willingness to be able to appreciate that. But as a family, I think highlighting to them that this is what's important to me, and this is what it means for X, Y, and Z scenarios within the context of my day-to-day being. As that example that I gave earlier, is that there was a strong family pressure for that particular father to remove the child from a group home setting. But how do we have that conversation? I think part of it is sharing, keeping in mind that can be intimidating for families. And if as institutions we recognize that, then hopefully that will cultivate a space to be able to share that. in a conversation that's healthy, rather than at a moment that creates tension.
Yeah.
Right? And I think we'll get to that a little bit later on.
Like doing it, proactively on the way in versus, when you get to that critical point.
Absolutely.
Right. And, that part of that is what we call advocacy. And if you visit learning.autismontario.com, that's available in the Resource Center. There's a whole bunch of these webinars and learning resources. Search the word advocacy and you can learn some very helpful tips and tricks for advocating at a hospital, clinic, or in the education system. There's a lot of good stuff there. This next question is an interesting one, and we're getting a little deep into your opinions a little bit. But in your experience, not opinion, experience, are you noticing cultural differences in diagnosis? I read an article that said often Black autistic boys' behavior is more often interpreted as misbehavior instead of related to anxiety or sensory challenges, and that concerns me.
Yeah, no, there's literature that supports that, right? To say that there are groups of individuals who end up having underdiagnosis of ASD and other neurodevelopmental conditions. And so certainly I think there is, even from my own experience, I think a part of the challenge is that, we don't often collect a lot of that data in the big picture. And so in an isolated individual case, certainly our interpretation of what's coming to us from families can vary depending on cultural encounters, and that's what the piece that I wanted to say. I think one of the risks is that as we swing towards standardization of our approaches, sometimes there can be nuanced elements that are more specific to an individual and their context that we can miss, right? Because we're so focused on identifying criteria A, criteria B, criteria C, and there may be assumptions that we bring into that clinical encounter and biases that can set up for a situation like that. And I think that there's an inherent risk in that in terms of, yes, the goal might be a diagnosis at the end, and then what are the implications for providing a support for that individual after the fact in a system where a lot of the support depends on diagnoses, right? So absolutely, I think there's data to back that up. A lot of that data is from the States. It's not Canadian data specifically, and not prevention.
And probably some other uniqueness about that culture that could cause that same problem. Do you know of any speech language resources for developmental language norms in different languages for preschoolers? My kids are in dual or more language households, and while there seems to be a lot available for school-age populations, there's not much for the younger children, so we use English-based testing, screening, and try informally to use these with other cultures, and there is an obvious bias in doing it this way.
And I think it's interesting, we've recently looked at lots of level 2 screeners that work around identifying concerns related to autism spectrum disorder, and that is one of the challenges. Actually, there's data to support that. If you take a look at 14 or 16 tools that are out there, there's not a lot of cultural adaptation or modification that's made to be able to understand that within, particularly within the preschool population. And I think we're more aware of it now, I think, and there's conversations that are taking place to address that, but we're not quite there yet. And I suspect we're not far from it, and I think one of the challenges is that you can take an English screener and translate it, but what I struggle with is the translation of a screener still capturing the concepts as that particular family might understand. And so I think that's where the challenge arises. But I'm not specifically aware of specific tools that have been adapted in the preschool population, but certainly there is work being done in that regard.
Great. And we added a book to the Resource Center as well, which was The Cultural Nature of Human Development, which talks a lot about the differences in development of children of different cultures and things to look at. There's a link to the Amazon where you can purchase that book. That's a challenge. There are challenges that you know. So what are some of the challenges and gaps that we are facing in our that haven't been brought up by our astute audience today?
I think some of the things listed on this particular slide really highlight the various levels. And this particular work was done with a group of social workers, occupational therapists, physiotherapists. It did not involve physicians, which is partly why I also became interested from my context. But certainly accessibility and availability to interpreters is often one of the big gaps. We've evolved to a degree with our ability to use, sort of phone translation services.
Yep.
I've actually started to use a lot of Google Translate and have had that cross-checked with interpreters to make
Yep.
sure that there's a degree of translation. But again, I think that sometimes that we've all been in the scenario where you'll have a conversation with a family. The interpreter will take that conversation and have a much longer conversation with the family, and then what gets reported back to you is a couple of sentences.
Yeah.
So there's a lot of cultural interpretation that's probably happening in that other conversation that we're not privy to. So how do we get into that space?
Right.
And that's where the questions come, right? And I think being open about those questions becomes relevant. Certainly, as individuals go from being first generation, second generation, third generation Canadians, there can be an evolution in terms of what values, what beliefs, what systems somebody is engaging with. And so recognizing that a father, a mother, and a child within the same family may not come from the same space in terms of their positioning.
Yeah.
And just being aware that there are resources, but those resources will vary from context to context.
Right.
And so a place like Toronto may have lots of availability, relatively speaking,
Yep.
to what might be considered more cultural resources for particular families with specific experiences. But that may not be the case elsewhere, right? So, and access becomes an issue in that particular setting. And all of that can then influence how you create your relationships with the families.
Right.
And this whole notion of rapport and trust, I think, is particularly important because what happens at the follow-up visit and the follow-up visit and how are recommendations being engaged with or not really does depend on that relationship that you've established as a provider with the family that is in front of you.
So a challenge, another one is us, and our language, right? Like the words we use. How does that play into it?
I think it's profound in terms of the implications that it has. And this is what I've become fascinated by recently, is that when we think about the term and the description autism,
Yeah.
spectrum disorder, that terminology doesn't exist in a lot of languages. And so that in and of itself says that what you and I might understand as autism, or what myself and a colleague of mine might understand as autism, having a very distinct profile. Obviously it's a spectrum, so there's nuances there. But if those concepts don't exist, or that terminology or an equivalent doesn't exist in other languages, I think the interpretation of that data, or what it is that we're telling families, can quite be misaligned, right?
Yeah.
Because you'll talk to families, and when they come to having used the word autism and say they're speaking another language, through interpretation, the word autism is used rather than an equivalent for that language.
Right.
I've come across some equivalent terms in different languages, including Arabic, for instance.
Yeah.
But again, the essence of that concept doesn't necessarily translate into what it is that you and I might be talking about.
Let alone, you say you and I mean, I'm out there, I talk about these webinars and what I learned from people like yourself, and I mean, it's not like everyone here has a full understanding of what that word means either, right?
Yeah.
Like it's got to get pretty it's got to get even harder in that world, like as everything that you've been saying. Okay, so how do we talk about it? Like, what's the...
So I think the challenge is that, again, taking some of the terms that we've listed over here, it's providing more specific examples of what this means, right? So I've tended to move away, even though I might introduce a concept by saying, what I was observing with your child was social communication. Well, what does that mean, right? And so being more specific with regards to examples of how we use different forms of communication together. So I'll often sit back and say, if I was talking to you like this the whole time, it's a very different interaction than if I'm talking to you like this, right? And so giving more concrete examples, and more importantly, trying to understand what those examples look like in particular, with particular cultures. So the most common thing, for example, that comes up is that, in our culture, for instance, culture X, that eye contact is not supported the same way that it might be in a Western context, right? So just being aware of that and recognizing that what we're often thinking about is the functionality of that particular child or individual in the broader community, obviously keeping in mind that that child spends a fair bit of time with their families and their, those that are in their circles, but recognizing that having an additional layer of description really does help.
Right.
In terms of helping families to see and understand and interpret what it is that you as a practitioner might be trying to provide, and then using metaphor, right? That's the other thing. I think there's a universality to using metaphors to a degree with families, and so being able to rely on that to again explain specific concepts can be again in a sensitive way, recognizing that there can be some barriers even within that communication.
I mean, there's words on here like adaptive functioning, which I can maybe sort out, but I've been doing this now for 6 years and heard most of it. I don't know all these words as well. So if you're using it in front of a non-clinician parent, it's going to be hard for most anyone to be able to understand.
Absolutely.
Okay. So you put this up as an example, pragmatic language abilities. What is this?
So this is about, the social use of our language. So when we think about language, we think about, what we say, what we understand.
Right.
We think about grammar, we think about vocabulary. We also think about how we use language to be social, right? And so there's different rules within the context of the use of language as a social entity, such as turn taking or interruption or eye contact that I gave as an example, that are very much driven by cultural norms.
Yes.
And so I think often what happens is that if you as a practitioner fixate on one of these and the family isn't seeing that as the primary area of difficulty or deficiency or challenge from your perspective, then that creates again some tension.
Right.
So that when you're providing feedback, and if the example that you're using is one of, your child does not have eye contact, but in that culture eye contact is not valued the same way, then that conversation, the likelihood of that conversation or feedback to move forward is low.
Right.
And I can say that's something as an example that comes up fairly commonly, but it's again trying to take a step back and describe all of this within the context of functioning, right? How do we support the functioning of the child based on the systems that we have in place outside? And yes, that may involve a degree of labeling with regards to diagnoses, whether autism or others, but also at the same time describing. And that fine balance between being able to do the two things together in a way that's meaningful to families, right? And I think it's reflecting upon the language that we use. So that exercise that I was sharing with you earlier where, we were talking about building simulations. One of the reflections that providers had as part of that is that in their conversations with families, they became more aware of the language that they were using. Right? As part of that process of saying, well, yes, I didn't think of it that way. Or perhaps the way that I ask a question. And so how do we get to that stage? And I think it's just creating that space.
Okay. Values around development. This comes from a study that is available online, Norbury and Sparks 2013. What do you mean when you talk about values around development?
I think it's about meeting the family where they're at, right? And trying to understand where families are at as a starting point in terms of what they identify as important to their particular child. And I think our conversations are shifting in that direction in terms of goal orientation and identifying strengths and weaknesses and building upon those. But what's interesting is that and what this particular paper really highlights is that the degree to which you're going to intervene in the broad sense of intervention is really going to be determined by how much value you're placing on whatever it is that you're trying to intervene on. Right? So what that means is that, if you set the goal as in improving eye contact and the family does not necessarily value that, there's going to be some challenges. That doesn't mean that you don't have a conversation about it, but I think it again forces you to take a step back and say, how do we facilitate this in a way that's going to be supportive to that particular child or youth from their experience, right? And I think a lot of that intersects with the literature that is emerging in terms of patient-oriented outcomes and goals that are driven from families. And there is a shift that's happening, but keeping in mind that you don't also want to standardize that shift. Because some of the nuances can then get lost in those day-to-day interactions.
I saw that. We had a very specific interview where we were talking about just how many times there's misalignment between the expectations on both sides, whether that be the parent and the child, or the caregiver and the family, patient and their family, because they get back together in a month and people are focusing on the wrong things. But I would argue, like when Bob Marley's Rastafarian heritage said he couldn't take any medication, and he died as a result of, I think it was something in his toe or a cut or something like that when it was long. I really should have got that right before I said it.
Yeah.
Aren't there things that are just right and wrong as it relates to this? Like, why are we talking, like, I've heard this before, I am challenging you, but I don't disagree with it, but are there things that are just simply right and wrong regardless of heritage?
Yeah, I think that that's an excellent point, because one of the things that came up in some of the research that I had done is this very valid question, but question that gets us to take a step back and think about is that how far do you go to accommodating or not accommodating what we perceive as quote-unquote Canadian culture?
Yes.
And what is the space there?
Yeah.
And there's lots of conversations at a political, governmental level, sort of human rights level that does implicate in terms of what we think is right or wrong.
Yep.
And I think the other challenge is that because of some of the subjective nature of what a child development is like, it creates this very interesting challenge for us, or dilemma, because there are practitioners out there that might be asking that question, like how far do we go? And that often comes up in context of feeding, sleeping, right, as simple examples where those conversations can happen. But that's where I think reflective practice is particularly important, and recognizing that, yes, each of us as professionals is bound by certain ethics and bound by certain guidelines that dictate our practice. And how that can then influence our interactions could create challenges. And I think a lot of those are driven case by case, but it's not uncommon to have those situations of tension and conflict where there might be significant differences that can affect that encounter.
This is a question from our audience, but you've worked at a couple different places. You were telling us your backstory there earlier. When it comes to culturally diverse practices, are there any programs, approaches that you've seen or I guess facilities in the province that you think are doing a really good job?
So I'm a little bit biased with this one.
Clearly.
Yes.
So on Joyce, number one.
No, I think certainly having had the opportunity to work across different settings and also partake with the SAC Autism Centre in Scarborough here in Toronto, one of the things that they've really highlighted is the opportunity for having culturally relatable, in a broad sense of the word, social workers and support for post-diagnoses.
Right.
And I think, again, for somebody like me to go and make a diagnosis and say, this is my medical developmental opinion, and what do you do with that information? I think helping families digest that information. The SAC Centre has been doing some great work, again, in collaboration with Autism Ontario, and also then equipping practitioners. So last year, we thought about in a lot of detail how culture influences that process, right? And what elements of that process is relevant. And so I think, when we think about parental well-being, we think about, availability of going to a community to be able to engage. I think there's lots of interesting work that's happening within the Toronto region, and more when we think about northern communities and how accessibility can improve. It's definitely a place where that's occurring. Again, the challenge is being able to be consistent with it, and how groups are funded and what that funding looks like over time really does play a role with that.
I love when a question comes in, and I'm sure this was asked a while ago, a question comes in that I can answer, but right now Ontario is mandated to offer service in English and French. When you talk about supporting culturally diverse families, is that related to just language? From what I've learned today, absolutely not, right? It goes well beyond language. And that was an old question, and I think you've heard that from Mohammed so far. This one is a good one. I'm going to go back and we're going to round out our presentation, but I think it's a really important question. First off, they want to thank you for the way you've been handling this very complex issue and how great this presentation has been so far. And then they get into this. Is there any suggestions that you may have to repair relationships or to re-engage communities who have never had a culturally safe experience?
Yes, I think it's about being able to identify within those communities what the concerns were to begin with,
Right.
in a space that is safe, with an open-mindedness to be able to say, okay, this is what our practice is like. We recognize that there can be differences. The tool that you've shared online that uses the Learn model
Right.
really comes from and is emphasized in work with communities where there has been a damage to cultural safety.
Okay.
And I think that that really lends itself to acknowledging first and foremost that there can be differences.
Yeah.
And those differences can influence what the outcomes of those interactions might have been. But to take a step back, because many of my colleagues have challenged me and said, like, and again, this can be a little bit out there, but the idea is that, across cultures, isn't it that parents want the best for their child?
Yeah.
Right? And that is a fundamental piece that many colleagues have said to me, is that, you think about this issue. I think there's a space for that comment within the context of yes, but it's the differences that exist that can influence what that best looks like.
Yeah.
And to be able to engage with families and caregivers that are providing and are often the go-to for a particular child or youth, and recognizing what that is, it comes down to conversation. And a conversation that's beyond language, right?
Yeah.
I think that you answered that very well. So it's ultimately about how do we then, sort of understand and start from that family's viewpoint.
Yeah.
And that was the point that was being made on one of the slides, is to say that if we're starting here and the family's here, or the other way around, we're not on the same page. And many of my social work colleagues will say, and I've really appreciated this, is that, let's meet the family where they're at.
Yep.
And that will then guide or dictate what the next steps will look like. And yes, there may be places where we don't agree or we have a strong disagreement, but that shouldn't mean that you're not continuing to engage in a way that will help to facilitate that relationship.
And especially if you need to turn them around on any one or two topics, I mean, you're not going to do that if you don't have common ground. They're just going to be, he thinks he's right because he's a doctor. Okay, I'm going to give you a time check here. We got about 10 minutes, and we got some content that we needed to get through here. This is the approach, where, when, and by whom that you follow or that you suggest.
I've sort of identified this as areas
Okay.
where, we as individuals and organizations and practitioners can really think about this. And we've sort of been alluding to this a lot, right? In terms of, obviously, processes that are in place, how we interview families, whether we do it more from a strengths-based approach. I've always wondered, again, families will come to practitioners with different experiences. And that's stating the obvious, but just to highlight that sometimes families will come with, the person who's going to be providing the care as the expert.
Yep.
They might also come to the individual who's providing care as a resource, or some combination of those as the expert resource. And so how do we, navigate that space with the families that we're meeting on a day-to-day basis in terms of the questions that we're asking, trying to understand where they're coming from, and just being curious.
Yeah.
Because I find, like, and one of the things is that because we get so fixated on getting through our checklist, is that we lose some of that curiosity in terms of what's brought that family to us, what's been that experience. And I think curiosity really helps develop a positive relationship. And
Right.
I'll be very direct with families. So I'm very curious to hear about, right? And tell me, right? With trying to suspend judgment, because we all do it.
Yep.
But how do you suspend judgment in a way that then allows you to learn something about that family that you may not have otherwise learned? And that then obviously filters into therapy and intervention,
Right.
and conversations about, I do a lot of work with medication in individuals on the spectrum of the neurodevelopmental disabilities. So how do we then engage in that conversation?
For sure.
But that would be sort of just areas that I've highlighted as spaces or places that can be helpful.
Earlier, you talked about your humbling experience already, and you asked the question, what happens when this information is given? And you asked some more powerful questions here, like who has the responsibility to digest that information? Is there an answer to that? Is it you? Is it the physician?
I think it's a collective, and the other experience that I want to just reference here was I had gone through my process in my mind very clear, saying that the set of twins that I was interacting with were meeting the criteria for autism spectrum disorder. The family was from a part in Africa with English not being their first language. I sort of communicated as best as I could what I thought my impressions were, and they sort of made sense in my head. But then when that family left and interacted with an occupational therapist in the community at the child's daycare, they said to the practitioner, said, listen, Dr. Zubairi said that my child has autism. I don't know what that means. Right? And so now I'm sure there's other layers to that in terms of what they were hearing and whatnot, but it really highlights that, you know, that occupational therapist then was really supporting that family in part of the digestion. There are other entry points that are there, and how do we collectively do that from even prior to them getting into seeing a person who's going to make that diagnosis. And I think the various services and resources that are available really need to collectively think about the language that we're using, collectively identify what those challenges are, and how do we, for the lack of a better word, prime a family to be ready or not in terms of what we do to take that information that we're giving them and working with that information. And so I think there is an opportunity there for other service providers, apart from the diagnostician necessarily, to think about that based on the conversation that we've been having, and that it's really a continuum. That, you know, that digestion of information is not going to happen at one time point. It may happen over time in a way that, you know, you may have quote-unquote success in one scenario, but may not in another scenario. And what steps have we taken to try to optimize what that interaction has been like?
And, you know, a light bulb goes off because, you know, when you're explaining the challenges with this, being a, you know, you might have some insights into someone from Pakistan or maybe Saudi Arabia, but you can't have it about all. How do you learn that? But there is a circle of care in the community which is quite often regionalized and maybe homogeneous, where at places like the school, maybe at the daycare for sure, and all of that, that you're going to have those other resources who can really help in this matter, right? Okay. We could get into collaborations, learning in best possible collaborations.
So it's about that consistency. So you just alluded to it, right? I think as we move forward, we want to think about the integration across different sectors, think about the integration across different service providers, and the implications for what that means for families that are, so work out of the States here, you know, which was investigating school-based autism treatments. Now, obviously, our system's a little bit different here within the Ontario region, but asking the questions of who is providing the intervention, you know, what is a proper education for a child mean from a cultural context, right? And the implications for that, thinking about strengths, thinking about the future, and thinking about that communication very broadly. And the challenge, and this has been something that, again, we just have to be aware of, is that in the absence of doing this in a way that's sensitive and safe, the experiences of the families might be one of discrimination and perceived racism, right? And that's a challenge. I think that we just have to acknowledge and say, okay, what are we going to do to work around that? And that's certainly an issue that comes up even, you know, anecdotally in families communicating that. But again, the implications for that with regards to supporting the children can be quite profound. And so I think ultimately that then influences, going back to that trust that we have with families, and continue to cultivate that in a way that's meaningful.
So you've done some research. You said there's research being done. Yours is a work in progress. What have you been finding?
So I think there's three things from a frontline practitioner perspective that comes up, and this is slightly different on this slide, but I'll come to this in a second. But basically, we've got a scenario where I think most of us are trying to be sensitive in the best possible way. We're often sensitive to visible elements. It's harder with the invisible elements, kind of sort of stating the obvious. The second is that even though we try not to get into situations of stereotyping, you know, given the busy nature of what we do and the parallels that we draw, we can fall into that trap clinically. And that can create some risks in terms of the interactions. And then finally, we tend to focus on diagnoses first, or what is the best evidence, and then revolve around tailoring that to cultural elements. The challenge is that oftentimes we're not going to those conversations, and that's what I write here on the first slide, is that we often start thinking about these issues in situations of tension or conflict. So when there is a disagreement, that's when, like, aha, oh, could this be a culturally grounded issue? I think we need to take a step back and say, as you've mentioned as well, how do we prophylactically or proactively be aware of these through different lenses ahead of time? And ultimately, if you don't, if you take a conflict approach, that's never going to be helpful for a relationship, right? So being able to understand that and preempt it in a way, recognizing that there's going to be conflict, that's the nature of us, right? But how do we support that? And finally, I really have emphasized this, is that moving a bit away from standardization and letting families go off script. Because what we often do is that we have a script, and we ask questions that come from a particular
script. Get the answer you need, move on to the next question.
Absolutely. So just finding those little moments in your day-to-day practice to be allowing families to go off script, because you're going to learn tons about them. And if there are those cultural nuances that you may not have been privy to before, you will recognize and appreciate those.
Right. And you go on to talk about professional factors as well, like I guess where the practitioner is coming from.
Yeah, I think, I mean, this is really, we've sort of touched upon a lot of these aspects already in terms of, you know, both the diversity of staff, the diversity of experiences, the diversity of our training, all influences how we recognize, are aware of, and deal with our own biases, and just being able to manage that within a clinical encounter where there are other pressures like time and efficiencies and all of those more higher level things that sometimes we may not be thinking about at the forefront, but could be influencing how we're delivering care, what parents are perceiving, what children are perceiving in terms of our interactions.
We are almost out of time. We got a really good question here that I'm going to ask you anyways, and then I'll let you finish up. My parents and extended family are struggling with my child's diagnosis, and they feel ashamed of him. Are there ways that I can help them understand while still respecting our culture?
Yeah, and that's a question that often comes up. I think part of it is, and I'm sure this particular parent has done their due diligence in understanding what their child's struggles are. And I often say that the parents are the best experts about their child, so where they're getting snapshots. I think it goes back to that piece of like, how do you describe what it is that we or a parent might take for granted in terms of these, what autism is. And I think, you know, recognizing it as a way of being and a way of seeing the world can be a challenging conversation, and it will take time because each of us, like I said, comes from very specific backgrounds. I still struggle with explaining what autism is to my parents. And I'll confess that because a lack of awareness, a lack of recognition, parents coming from parts of the world where there just isn't the same level of understanding, and then what it means for that individual. So trying to, you know, I had a recent experience where I gave a whole talk in Urdu to a group of folks from Pakistan, never having done that before, again, through work that was supported through Autism Ontario. And the appreciation I got was that, you know, you really tried to distill those concepts in a way that were understandable to us. And I think that becomes the onus of the parent to a degree, but also engaging the parents with clinical appointments and encounters to say, these are the things that we're working on, this is how it's going to help that particular child function, right? Because that's really what we have control over, is supporting the function of a child. And I can't emphasize that enough, because yes, we think about diagnoses and compartments, but how do we move that forward into meaningful support for that particular child in their context, wherever that might be.
Try explaining to your parents that you host webinars. That's an interesting one too. We're out of time. Is there anything that we didn't talk about today that you wanted to leave everyone with, their moment of Zen, if you will?
I think it really is about going back to your respective practices, your day-to-day encounters, and just thinking about this more deeply. It's a work in progress for many of us. I think people are reflecting on this issue in isolation. Just creating the space to be able to have these conversations collectively really will, I am confident, will make differences in individual clinical encounters, but also in the practice that exists collectively.
Excellent. And with that, we are out of time. And so, a reminder, I said at the top, I'll say it again, this presentation will be recorded, archived, and available on the Autism Ontario website and learning.autismontario.com later on today or earlier tomorrow. You're able to share it with your family and loved ones. anyone who you think in this province or in this country would benefit from Mohammed's presentation today. I think we have a resource that we need to add there, so when you get the follow-up email, click on the link and download that. A reminder, there's a series of great resources if you haven't hit them on the Resource Center. This presentation, we didn't get through everything that was there, so you can download that in both official languages. And there are also links to the Access Counts 2019 Autism Conference, sign-ups for the Autism Ontario newsletter, where when there is more on this topic or any of the topics we discussed, you'll get that in your inbox. The benefits of membership with Autism Ontario, and a couple of the other things that we had referenced today. That's all the time we have, and so I want to thank you for your participation as always. I want to thank you, Mohammed. It was a great conversation, and we'll see you next time at our next Autism Ontario event.